The scars we have on the outside are easy to recognize, but the scars we carry on the inside can be much more subtle, yet no less traumatic.
Post-traumatic stress disorder is a psychiatric condition that can occur after experiencing or witnessing a life-threatening event. Such was the case of one woman who survived the deadliest wildfire in California's history.
We went to bed that night. Before my daughter went to sleep, she came and got us, and she said, "I smell smoke."
At 3:45, I saw an orange glow outside my window, and I got up and looked, and I could see fire right underneath.
Last October, Leisha Pontes and her husband Ross came face to face with a deadly firestorm that nearly destroyed their home and their lives.
The house was rocking. The fire was everywhere. We realized the most important thing now is to gather our pets and to get out. You could see people in the cars, and as we passed our neighbors, we knew we couldn't help them. There were people on fire.
The Pontes home was the only one left standing in a neighborhood of 12. While her house survived, Leisha was shattered and then diagnosed with post-traumatic stress disorder.
After the initial fire, our lives were impacted in every possible way. Everything changed for that first few days. We were in shock. Nobody was functioning to a degree of other than survival. I would be awake until 3 or 4 in the morning, and I just wasn't relaxing. I was always on the edge. You get used to not sleeping, but not feeling happy isn't a part of my normal life.
Like others suffering from PTSD, Leisha was depressed, had intrusive thoughts, and startled easily. Leisha turned to Dr. Robert Bray for help. Bray specializes in the treatment of post-traumatic stress disorder, also known as PTSD.
Post-traumatic stress disorder is a condition that exists as a result of having experienced a life-and-death situation.
I definitely well up into tears more, and there's just an under feeling of sadness.
First, Bray showed Leisha a videotape of news footage of the fire to gauge her emotional reaction.
Okay, I'm done.
Okay, where are you at?
I'm uncomfortable enough.
Okay. So what I want you to do is I want you to tap gently on the side of your hand, just like this.
Bray employs a highly successful method of treatment called thought-feel therapy. The patient is asked to tap points on the body in a precise sequence while humming or counting.
1, 2, 3.
Thought-field therapy is a way to eliminate overwhelming emotional distress. It turns out that the control mechanism for the mind and the body and the emotions is accessible through the acupuncture points of Chinese medicine. The fact is that it works.
When I met with Dr. Bray, I was surprised that he had some different methods of dealing with stress. And the first thing in my mind was, it sounds like voodoo. It definitely opened something up in my head. I definitely walked out of there with a lot less anxiety. I relaxed for the first time in months. I have to believe that we can go through these things and be braver and stronger for it. There is help available. There's no reason to suffer anymore. That fire needs to go out.
If you believe you're experiencing post-traumatic stress disorder, see your doctor. Behavioral therapy, psychotherapy, antidepressants, and support groups have all been known to help. This is not the time to go it alone. One thing you won't suffer alone is allergy. In today's